Good afternoon, everybody. Welcome to week 2 of UMW's COVID-19 in Context, a course with the largest enrollment in Mary Washington history. I'm happy to welcome you back, along with viewers from 39 states and 6 other countries. We are really in for a treat this week. We have 2 amazing talks lined up with some very good speakers. I'm sure you're going to love it. I'm happy to welcome our first speaker, who is my co-host and co-facilitator for this course, Dr. Anand Rao. He's a professor of communication and also the chair of the Department of Communication and Digital Studies. He's going to be talking to us today about communicating COVID-19, how we talk about a pandemic changes what we do. Dr. Rao.
All right. Thank you very much, Dr. Mellinger, and thanks to everyone joining us this afternoon. I'm going to be joined by my colleague, Dr. Elizabeth Johnson-Young, for the Q&A. Given her expertise in health communication, I look forward to hearing how she's able to answer some of your questions about this public health emergency. Now, there's so much to say about the study of communication and digital studies during this crisis. There's journalistic coverage of scientific data, analysis of political communication, study of online disinformation and hoaxes, construction of effective public health communication campaigns. These are but a few of the projects that my colleagues in the Department of Communication and Digital Studies are currently working on. We can't wait to share them with our students this fall. Now, my primary area of study is the analysis of public argument. And in this presentation, I'd like to focus on effective and ineffective public argument in the development and application of policy in response to the COVID-19 crisis. Now, at this stage, I think we can look back over the last 3 months and point out what did and what didn't work. Now, my main point boils down to this: words matter, and particularly true for effective leadership. They matter because if we do not communicate effectively about a crisis, we are not able to successfully respond to or deal with that crisis. Now, I'd like to structure my presentation around 3 key points. The first is that events and public expectations will create a need for public discourse. We talk about this as rhetorical action in response to an exigence, and I'll outline exactly what that means. Secondly, effective public discourse is key to public understanding and public action, and we'll look at some examples of that. And then third, I'd like to outline what the public has been looking for in public argument about this crisis. And throughout, I'll include examples to illustrate how effective and ineffective some of our leaders have been in making their case for action during this crisis. Now, any of you that are CDS majors or have taken a communication class know that any good rhetorical or communication analysis should start with some analysis of the audience. And for us, the audience is the American people, the public. And it can be dangerous, of course, to rely on generalizations, and we should always note important differences between various groups represented within the public. You know, we live in a time where our politics are divisive and highly polarized. We've come to expect the public views on most issues are going to fall along party lines. Now, while we do see some party differences on a number of issues related to the COVID-19 crisis, it's useful to look for some key commonalities, and survey data from the last 3 months point to very interesting areas of common interest. These areas of common interest bear on how public argument is understood and responded to. And in particular, the vast majority of the American public, I've found, has shared a common perspective on 2 key issues that are outlined here. The first, the public wants to be informed about COVID-19. And secondly, the public has valued information from public health experts. Now, let's start with the public wanting to be informed about COVID-19. Now, throughout March, survey data confirmed that public health messaging was getting through. Americans were paying attention, and they were generally taking the actions recommended by authorities. A mid-March Wall Street Journal NBC News survey found that 99% of the American public had read, seen, or heard about the virus. Now, that seems kind of obvious. It would have been hard to avoid hearing messages about the virus. It was permeating every discussion point, every bit of media across the country. So that's not that surprising. But what's also important to note is that a Gallup poll around the same time showed that 93% of Americans said that they were actively following the crisis, and 66% of Americans were following it very closely. Now, this is the second highest level of close attention to an issue since 1991, when Gallup started asking this question, and it's behind only the events of 9/11. Now, it's one thing to be aware and to follow an issue. You know, if you look at the political spectrum and you ask people across the spectrum if they follow updates on climate change, they might all say they follow aspects of climate change, though they might have very different understanding of the issues. That wasn't really the case in March with the American public as they sought information about COVID-19. Not only had they heard about it, they also had a high level of understanding. This is according to a Kaiser Family Foundation study that tested the knowledge of virus-related issues. The study found that the majority of the American public was able to accurately answer questions about such issues as the availability of a vaccine, how to avoid getting the virus, symptoms, who was at highest risk. Now, the vast majority of the American public wanted to be informed, and they had a shared understanding of the virus and the crisis. Now, of course, it was not always that easy to get the information that we were looking for. And that brings us to the second point, that the public has valued credible information. They've always looked to public health experts for that information, and even more so during this crisis. This is the first evidence by a shared concern over misinformation. The public was not going to trust just anyone when it came to COVID-19. Now, there were only slight party differences in how this concern was viewed. According to Gallup, 82% of Democrats, 79% of independents, and 73% of Republicans believed that there was a concern over COVID-19 misinformation. They saw this as a major problem, and that was as recently as May 11th. And when they were asked about primary sources of misinformation, 68% of those surveyed blamed social media, saying that was the primary source of misinformation. And the second, with 54%, cited the Trump administration. Certainly a concern when we're talking about public argument and public policy. Now, the Pew Research Center also reported in May that America's confidence in medical scientists has grown since the COVID-19 outbreak. And we're at a point now, it has been a high in recent memory, of 87% of those surveyed expressing a fair or great deal of confidence in those medical scientists. So the public across both parties have viewed health experts as the most favorable source of information on the crisis. Now, an excellent example of this is Dr. Anthony Fauci. One of the Gallup polls in April even found the American public viewed him more favorably than they did the government health agencies that he represents in most of the briefings that he's found in. And I'm sure that we're all familiar with some of what he's been able to bring to the press conferences of the White House, as well as testimony in Congress. Now, I think the lesson to a lot of this is that as fragmented and divided as they might typically appear, when faced with a life-threatening situation, the American public is united by a desire to make an informed decision. Now, with this understanding of how the American public has accessed and valued information about the crisis, I'd like to turn to the first point that I'd like to make today, and that is that events and public sentiment create a need for public discourse. Now, in a study of public argument, we often refer to this as a rhetorical situation. It's roughly defined as a complex of persons, events, and conditions that result in the need for a speech act. And in this kind of situation, we identify an exigence, an urgent need or demand that must be addressed. And we're looking for rhetorical action, a speech act to respond to that crisis. Now, unfortunately, the COVID crisis is not the most recent exigence that our society is facing. We're in the middle of a rhetorical situation right now, sparked by the tragic killing of George Floyd, met with protests across the country, and our nation's exigence, the urgent need or demand, is to address systemic racism. As James Bennett, editorial page editor for the New York Times, noted just the other day, we're at a moment in our response to the killing of George Floyd in which, quote, the nation longs for words to strengthen it, and we look to our leaders to provide that strength and direction. Now, in a similar vein, the rhetorical situation that I'd like to speak to today is one that had certainly a very strong exigence, and that's one that presented itself on Wednesday, March 11th. It wasn't the first time that we'd heard of coronavirus for most of us, but it was the day when almost everything seemed to come to a head. Wired magazine has assembled an oral history of what they refer to as, quote, the day that changed everything. Now, that morning on March 11th, the story that the media thought would dominate the news cycle was the sentencing of Harvey Weinstein. That ended up not even being the biggest Hollywood story of the day, when later in the day we found out that Tom Hanks and his wife Rita Wilson contracted COVID-19 while on location in Australia. On March 11th, the US was grappling with the spread of COVID-19 with more than 1,200 cases in 42 states and DC, and at least 37 deaths from the virus. The NBA abruptly suspended the rest of its season that evening after announcing that a player on the Utah Jazz had tested positive for COVID-19. And the even bigger news was the World Health Organization declared that the spread of COVID-19 had been classified as a pandemic, something they had been reluctant to do. As World Health Organization Director General Dr. Ghebreyesus stated,
we cannot say this loudly enough, or clearly enough, or often enough. All countries can still change the course of this pandemic. Some countries are struggling with a lack of capacity. Some countries are struggling with a lack of resources. Some countries are struggling with a lack of resolve.
Now, on March 11th, the public still did not fully understand what was going on, nor did they have a developed understanding of the virus or necessarily why it was a threat. But those were all reasons why there was such an urgent need for action. We all understood that there was a need for a response, a speech act from our leaders that would help us make sense of the situation, provide some guidance as to what we as a community would do. The White House certainly recognized this exigence and that the need for a speech act had emerged, and an Oval Office address was scheduled for 9 p.m. Now, presidential addresses from the Oval Office are not common, but they are typically expected in response to a crisis. And there are a couple that probably come to mind for those of you that think about Oval Office addresses over the years. After the Challenger shuttle disaster on January 28, 1986, I remember President Reagan addressing the nation that evening from the Oval Office. Many of us also remember President George W. Bush giving the Oval Office address the evening of September 11, 2001, after the terror attacks on the World Trade Center and the Pentagon. Now, the address that President Trump would give on March 11th was certainly high stakes. The nation was worried, the markets, investors were skittish, and the plan going forward was unclear. And when a rhetorical analysis, we would analyze what was expected of the speech. What would it take for it to be successful? And to be fair, that is a very tall order. There's no speech that's going to by itself stop a pandemic, nor will it halt the spread of the virus just with that speech. But a successful speech can let the public know that there is a plan, that their government has the resolve to see us through this crisis. President Trump does attempt to tell the American public that actions have been taken and that the United States will be successful in its fight against coronavirus.
My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus.
Now, the best measure of a speech of this kind is how it was received. And by that measure, the speech missed its mark. It's largely due to what was missing in the speech. David Frum, former speechwriter for President Bush, commented in The Atlantic, noting that while the crisis was not of Trump's making, the speech lacked any of the specifics you might expect from such a speech. There was no guidance on policy on how to prevent the spread of the disease. There was really no explanation as to what had failed in the country's testing plans, no indication of how workers would handle the inevitable economic downturn, nor were there specifics about how the government what would they offer in terms of fiscal policy. Now, one of the few specific actions outlined in the speech, that of a travel ban from Europe, even that had to be clarified and walked back with tweets sent later that evening because they weren't really clear about whether it was cargo or people or both. Now, much of the substance of the speech focused on the foreign origin of the virus and broad stroke defenses of the Trump administration's actions. The test of the speech's effectiveness also comes in measuring how well the speech met its goal to assure and calm the public. By this measure, the speech had little to no effect. Public opinion or approval of the president did not increase as the White House had hoped to see. Approval ratings stayed at around 44% in the days following the speech. Disapproval ratings were fairly consistent around 54%, with some polling even showing that disapproval ratings increased 1 or 2% in the days that followed. The speech did not increase the public's confidence in the administration's handling of the COVID-19 crisis. Now, another measure of effectiveness came in financial market reaction. I would argue this is an important measure as President Trump often has made the case for his administration's success in economic terms, pointing to low unemployment, economic growth, and a rising stock market. In this speech itself, some of his most direct defenses come in terms of the strength of the American economy and the ability of the economy to rebound. Now, not only did the speech not calm the markets, it made them more skittish than before. Futures markets started dropping during and immediately after the speech, and the Dow Jones experienced a 10% drop the next day, the largest point drop in more than 30 years since Black Monday in 1987. Now, there is more to study with the speech. We could evaluate and analyze various elements, including delivery, how arguments are made, the way evidence is provided. I think the key takeaway for our discussion tonight from this analysis is that existence of an exigence and the recognition for the need for a speech act doesn't guarantee the speech act is going to be successful. More needs to be done to connect with the audience. And the speech did not include the public health data the public was seeking. In fact, President Trump had been criticized for the previous weeks for challenging and often misrepresenting that public health data. The president needed to do more to inspire his audience to understand and take action. The exigence, the urgent need for action still existed. Most ended up looking to their state and local governments for their response. And that brings me to my second point, that effective public discourse is key to public understanding and action. Now, recall our opening discussion about the public's interest in expert testimony, scientific evidence, and data-driven decision-making. One of the best examples of a speech that met this need was given by a public health expert that many had never heard from before. The speech was given as part of a one-hour press conference held by Illinois Governor J.B. Pritzker on March 20th, where he announced a stay-at-home order for the state. The speech was given by Dr. Emily Landon, the chief epidemiologist at the University of Chicago Medical Center. The speech was only 7 minutes long out of the 1 hour-long press conference, but that's the speech and the portion that most viewers recognize from the press conference, and I'm sure many of you watching probably saw it in your own social media feeds. It was shared widely and referenced in major newspapers. The speech resonated with many across the country because, I would argue, that it provided the kind of communication, the very appeals about the crisis that many people were looking for.
First of all, I want to send my sincere gratitude and support to all of the healthcare workers in Illinois and around the world. All of us in the field of infectious diseases and the public health community are united in our efforts and agree with this course of action. I've spoken with many of my colleagues across the city and the state, and we all acknowledge that this is the only way forward.
Now, her credentials gave her a lot of credibility in how she could speak to the public health crisis, of course, but she didn't rely on medical or technical jargon to maintain that credibility. Dr. Landon effectively drew upon the types of appeals that meet the demands of the situation. And with her experience in her own hospital, she was able to connect the current situation with the cautionary tale of the 1918 pandemic, which she does a little later in the speech. Now, she also speaks clearly and emotionally about the crisis, uses informal language, and effectively speaks to what we're all experiencing. For example, at one point, she talks a bit about her own 5th grade son and his having to miss his book club, sports, and the science fair. And then she connects that with an explanation about how what we're experiencing is warranted.
These extreme restrictions may seem, in the end, a little anticlimactic, because it's really hard to feel like you're saving the world when you're watching Netflix from your couch. But if we do this right, nothing happens. Yeah. A successful shelter in place means that you're going to feel like it was all for nothing. And you'd be right, because nothing means that nothing happened to your family. And that's what we're going for here.
By virtue of her experience as a medical doctor, through her accessible and engaging presentation, she was able to inform the American public about what it meant to flatten the curve, how we could help take the pressure off of our hospitals, and why the government orders to shelter at home were exactly what we should all wish to comply with. Now, how successful was the speech on March 20th? Well, there are a number of ways we can measure this. The first would be how others have looked at the impact on public health outcomes. On April 10th, the Chicago Biomedical Consortium stated that looking back, Emily Landon might have been one of the major influencers behind flattening the curve and helping to save lives in Chicago, Illinois, and beyond. Now, the speech was also given during Governor Pritzker's press conference, as I mentioned, announcing the stay-at-home order. The Chicago Tribune reported on a survey a little bit later conducted by Harvard, Rutgers, and Northeastern that found that 69% of those in Illinois approved of Pritzker's general handling of the outbreak. But what was also noted in the survey is that 93% of people in Illinois approved of the stay-at-home orders that Dr. Landon spoke in defense of. The arguments presented by Dr. Landon were clearly well received by the public, and they helped drive public understanding and action. Now, in this last section, I'd like to further outline what made for effective public discourse during the crisis. In response to COVID-19, political leaders, such as governors, could make emergency declarations for schools and businesses to close, but they're not able to effectively stop the spread of the virus unless the public is motivated to carefully follow through with actions such as social distancing, mask wearing, hand washing. So I'd like to look at the examples of two different governors and analyze how effectively they were able to appeal to their own states. The first example I'd like to look at is that of Governor Brian Kemp from Georgia. Despite Georgia being the home of the Centers for Disease Control and Prevention, the Kemp administration has not inspired much confidence in its response to the COVID-19 crisis. Through the end of March, Governor Kemp repeatedly stated that the pandemic in Georgia did not warrant the extreme social distancing measures that other states were imposing. Now, Georgia faced scrutiny for sloppy data reporting. For instance, by the start of April, public health officials in Georgia reported they had close to 5,000 cases, 154 deaths, and 631 new cases and 29 additional fatalities in one day. But the Atlanta Journal-Constitution did a little bit of investigating. They found those numbers were actually lagging behind real-time reports from some of the hardest hit part of Georgia. For example, in Daugherty County, which had the largest cluster of cases, they were listed on the state side as having 29 deaths, but the county coroner reported to the Atlanta Journal-Constitution they actually had 37, with 23 more in surrounding communities, many of which were not reported. The public health records were at best sloppy, or at worst intentionally misrepresenting the state's COVID numbers. And it's been a persistent problem, as in May when the Atlanta Journal-Constitution again investigated, and they found that there was a misleading chart posted on the state's Department of Public Health website. And in that chart, it included dates out of order, suggesting that cases were declining over time. The Kemp administration has not had a good track record of providing transparent and clear communication about the crisis with the state. Now, up through March, as I noted, Governor Kemp was repeatedly rejecting the idea of imposing a stay-at-home order, and he resisted them until April 2nd, when he issued a statewide shelter-in-place executive order. And in his one-hour press conference announcing his executive order, Kemp admitted that he felt it was necessary to enact the shelter-in-place because, as he said,
finding out that this virus is now transmitting before people see signs. So what we've been telling people from directives from the CDC for weeks now, that if you start feeling bad, stay home. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours. And as Dr. Toomey told me, she goes, this is a game changer for us.
As Aaron Blake wrote in the Washington Post that same day, quote, "It may have been a game changer, but it was a game changer weeks or even months ago. That's when health officials started emphasizing that asymptomatic people are transmitting the coronavirus. The idea that Kemp didn't know this is striking, but he's merely the latest top politician to indicate that he's unfamiliar with the science, even as he's making life or death decisions for his constituents," end quote. Now, Kemp has come under fire for this admission, as well as his decision to start to reopen the state later in April. His administration's handling of the crisis bears responsibility for Georgia having one of the higher number of cases per 100,000 people, around 10th in the country, with more than 50,000 cases and 2,100 deaths. Now, Governor Kemp's poll numbers also reflect his ineffective leadership, as noted in the May 19th in the Washington Post with an article titled, "49 of 50 governors have better coronavirus poll numbers than Trump." You can take a guess as to who the outlier is. Governor Kemp and President Trump's approval ratings were tied at 43%. The next closest was Hawaii Governor David Ige with 54%. No other governor than Kemp had below 50% of their constituents supporting their response to the crisis. Now, within this article, they talked a bit about the average coronavirus approval ratings for Democratic governors in the poll being 69% and Republican governors an average of 67%, roughly on par with each other. But it was really interesting to note that most of the highest and lowest approval ratings belonged to Republicans, with Kemp at the very bottom. Of the governors with the top poll numbers, 6 of the 7 were Republicans who were receiving more support from Democratic-leaning voters than Republicans, though it's important to note that the majority of voters from both parties supported their governor's response to the crisis. Now, the second example I'd like to look at in this presentation is in this group, and it's Ohio Governor Mike DeWine. DeWine, a Republican, was at 80% overall in this poll and 86% in another conducted around the same time. And this includes support from 92% of Democratic-leaning voters and 74% of Republican-leaning voters. The Post article about the poll results notes that those governors with a steady, competent response have benefited from higher approval ratings. It's not a surprise, as it fits what we found in the earlier poll numbers that we looked at the beginning of the presentation. Governor DeWine was referenced as a model for the nation in how he handled the crisis, and much of that success is owed to how he was able to communicate with the people of Ohio, which is why I wanted to outline this example. Now, Governor DeWine spoke early and often about the crisis. He held a press conference about the preparation for the state's handling of the virus as early as February 27th. And on March 3rd, he announced the first big action taken by any state governor in announcing that a major sports festival in Columbus would not be open to the expected 200,000 spectators that were on their way. Now, at the time of the announcement, there were no confirmed cases of coronavirus in Ohio. Now, Governor DeWine would lead the nation with his actions. He declared a state of emergency on March 9th when they only had 3 confirmed cases in the state. He was the first governor to close schools, to prohibit spectators from indoor sporting events, and he postponed the state's primary that was slated for March 17th. Early on, Governor DeWine started holding daily press conferences and was joined by Dr. Amy Acton, the state's public health director. Now, these were all actions taken by the governor to protect his state, and the orders were effective, I would argue, because of how effectively the governor and Dr. Acton engaged with the public through transparent and clear communication about the crisis and the actions that they were advocating. Now, there are 3 characteristics of Governor DeWine's communication strategy that have been particularly effective and that are a good fit for what the public has been looking for during this crisis. The first has been consistent and transparent communication. As I noted, from early on, there were daily live stream press briefings with the governor, and he would include health experts in addition to Dr. Acton. And these quickly became primetime viewing for thousands of Ohioans that were eager for information about the virus's spread and the state's lockdown orders. And think about that context. At a time where most people were in shelter-in-place orders to stay at home, they had access in the middle of the day to these press conferences to find out exactly what was going on, and that really resonated with the people in the state. The Christian Science Monitor conducted an interview with a Columbus business owner in May about this, who noted that, quote, they were so good at presenting ideas and giving people the opportunity to digest them and process them before they were implemented. Now, the second characteristic was Governor DeWine's willingness to admit unknowns. Early in the crisis, Governor DeWine would often emphasize the lack of information and uncertainty to the public. This, coupled with frequent communication, reinforced his transparency and openness with the public. And it also meant that he didn't have to squander political capital on items he wasn't sure about. He had more credibility when he could speak to something about which he was confident in. Now, his daily press conferences included updates on orders and policies, and he also offered appeals for why the public should follow him in an approachable and folksy way. Here's a little snippet of one where he's talking about the recommendation to wear masks in public.
Let me talk a little bit about masks that have been very much in the news. Yesterday, as you may have heard, we have a new advisory from the CDC in regard to the wearing of masks. And I know Dr. Acton will talk about this in a moment. For those days that I am in public, I intend to wear one of these masks. These are some that Fran has made, and some other ones that she's made. But I think we should look at them as something that we can do that should be socially acceptable.
His attempt to really connect with the audience resonated. They saw him as very approachable and speaking to their own experience. And this also is reinforced with the third characteristic, and that has been his reliance on experts to reinforce the need for the actions that he was mandating. Here's an example of Dr. Amy Acton during one where she's giving daily presentations about some of the data in the state.
I have a lot I want to share with you today. You know, we try to be lighthearted because we want to stay connected. I also have some serious things to talk about today. So let's go ahead and start with the data. First of all, at this point, we are at 3,739 cases as of this morning.
Now compare that to the accounts of Georgia having incorrect data on their public websites. In Ohio, the people in the state knew exactly what the count was every day, and they had confidence in the data that was being shared. Now, Governor DeWine's selection of Dr. Acton as public health director was actually his last cabinet selection in January 2019 at the start of his term. She's the first woman to hold the position, and her 2 predecessors were not even medical doctors. In a BBC News article from early April titled "The U.S. Governor Who Saw It Coming Early," Governor DeWine is quoted as saying that mistakes that I've made throughout my career have generally been because I didn't have enough facts. I didn't dig deep enough. So I made up my mind I was going to have the best information, the best data available. Now, as the BBC also noted in his daily briefings, Governor DeWine is quick to defer to Dr. Acton for specific questions on the virus and its spread, reminding Ohioans that the state's decisions are driven by science. Now, Dr. Acton has become a bit of a celebrity in Ohio as a result of this. The Dayton Daily News has called her Ohio's trusted face during the pandemic. And here's a picture of a tweet that was sent out by the minority leader in the Ohio House, Representative Amelia Sykes, talking about watching a press conference and noting that Dr. Acton is the real MVP of Ohio's coronavirus response. Now, Governor DeWine and Dr. Acton were not without their detractors. There were protests later in the spring to reopen the economy. Dr. Acton was the subject of a lawsuit that questioned how far she could go to enforce public health orders. But by and large, the public in Ohio tuned in, and they listened to Governor DeWine and Dr. Acton. Most references to Ohio's handling the crisis refer not just to the governor, but to both the governor and Dr. Acton. They even have their own fan clubs and were the subjects of a fun parody of the old Laverne and Shirley TV show opening.
1, 2, 3, 4, 5, 6 feet apart. Stay home. Stay home. How's about we coordinate it?
What connected with the public were the elements of Governor DeWine's communication strategy that the public was looking for. Remember at the start of the presentation, I highlighted from public opinion polls and surveys, the public has been motivated to know more about COVID-19, which they were getting in these briefings. They've been wary of misinformation about the crisis, and they have greater confidence through these briefings. And they valued scientific health experts, which has certainly been at the forefront of Governor DeWine's approach. Now, the end result of this has been a successful crisis response, not only looking at poll numbers, but also that it's helped flatten the curve in Ohio. A relatively lower 323 cases per 100,000 people in Ohio, just over half of what its neighbors Pennsylvania with 621, Indiana 550, or close Michigan with 586 have had. Now, going forward, certainly the summer months will be different than the spring, and there are signs the public consensus regarding the crisis is starting to falter. A Pew Research Center report from last week shows that there's a growing partisan divide in how the public views coronavirus as a threat to our health, and that's certainly a concern, because if we don't have that consensus, it's much more difficult to be able to appeal through public argument about what actions the government needs to take. We might see some in the public revert back to pre-COVID partisan leanings, but I think there's still opportunities for our government officials to learn the lessons from earlier in the crisis and how they communicate about COVID-19. These come down to the characteristics that I've outlined today. The public wants transparent and open communication about the virus. And they expect to hear from public health experts about what the science is telling us. And the culmination of these is the continued use of data-driven decision-making. We all know that we have only made our way through the first phase of COVID-19, and we have a long way to go. We can only hope that our leaders will employ the type of public argument that will enable us to work together so that we can not only save lives, but also continue to prosper as a society. So thank you for your patience. I look forward to some of the Q&A, and now I'm going to turn it back over to Dr. Mellinger.
All right, thank you very much. That was terrific. You know, the problem with giving such a good talk is that you get lots of questions. So I hope you're ready, Dr. Rao. Let me start by introducing myself because I forgot to do that at the beginning. My name's Keith Mellinger. I'm the Dean for the College of Arts and Sciences, and thank you all for joining us today. We have a great turnout here, and we had a wonderful talk. So it was just terrific. Again, we just finished with Dr. Anand Rao, our professor of communication and chair of the Department of Communication and Digital Studies. And he's also joined for the Q&A by his colleague, Dr. Elizabeth Johnson-Young. Dr. Johnson-Young, you can go ahead and unmute yourself there so we can all see you. There you are. We have a lot of questions that have come in. So as long as you're ready, let's jump right into it.
Excellent.
Okay, so there's of course some common themes here, and so I'm going to do my best to try to put together the common themes. But let's start with a question that got quite a lot of upvotes. A lot of people are interested in. How can you tell if somebody is deliberately spreading disinformation or accidentally spreading misinformation?
Let me turn it over to Dr. Johnson-Young. I think given your expertise with health communication, this is a perfect one for you.
Yeah, I actually saw that question and a question really similar to it about disinformation that I think were really great questions. And you know, it's hard to know if it's deliberate unless you think, track it back to who is originally putting out this information, because I think a lot of us come to this particular information when it is false or in some ways misconstrued information. We come to it from a third party in some way, right? It's handed down. And that makes it significantly more difficult to figure out if something is false, because if a friend is showing it to us or someone that we trust is showing it to us, we may then trust the information. So it's hard to know that particular piece, but I think, in the end, and I'm kind of combining with the question I saw, I hope that's okay, about if it's what makes it sufficient for to be classified as disinformation. And I think, a major piece of that is it's probably, while it's important to find out if something is misinformation and see where it stems from, to see if there's some kind of motive. I know that that's probably what we really want to find out. But another piece of it is that we want to make sure that we do something about that misinformation, whether or not it is intentional or not. And I think that's a really important point of it, because even if it's a passive passing on of some kind of link I'm thinking kind of about pandemic in some ways, that it just kept going and going. If we don't try to stop that spread of the information or question the information, if that somehow leads us to behavioral changes that we don't want to see, that's where it becomes dangerous. So certainly finding out why that's happening and where it's coming from is important, but I think also just generally the repercussions are.
Right. All right. Thank you very much. The next question has to do with communication in the U.S. compared with communication in other parts of the world. So let me thinking about that a little bit. Let me read to you the question here. Why do you think that most of Europe they've done better at communication and communicating the seriousness of the threat to public health? Is it something to do with how they communicate with the governmental structure, their culture? I mean, what is it that's different in other parts of the world? And I want to add that some of this might be touched upon a little bit in other lectures of the series here, but I'm curious on your take on this as a communication expert.
Sure, I'll take a first stab at it. I think this will be touched on with some of the later presentations that we hear within this course. I think there are probably a number of different factors. If we just look domestically, the fact that with the current administration, they defunded things like an office that would deal with pandemics, and they defunded and really undermined early on a lot of the communication that was coming out of some of the public health agencies. That was a real concern. And as I noted, President Trump received a lot of criticism for having very different approaches to discussion of COVID-19 through January and February, to the point that it was difficult to know whether or not he believed it was true, he thought it was going away, what was happening. I think the administration was much better later with some of the regular press briefings. And that's another area that I would love to explore, and I certainly plan to this fall, looking at some of those press briefings with the president and with Dr. Fauci and other leaders. I think there was a much better job done of being able to share that information with the public at that time. It's also kind of interesting, I noted that people were looking to their governors and local officials for responses. Part of this is also a response to the fact that we don't have the same kind of governmental structure. So this is one aspect of it. You would expect for stay-at-home orders to come from your governor and your state and not nationally. And that's probably a little different with some of the nations in Europe. And so that probably factors in. I think there are also some cultural differences and relationships between the public and whoever's in office. It's not to say that they were successful in every country, but there were some countries that were more successful. And I think those are probably the ones, at least the ones I'm most familiar with, are the ones that were more popular. They already had a better connection with their audience and with the public, and they had done a better job leading up to it, talking about other public health issues. Dr. Johnson-Young, you might be able to speak, if you want to speak to this as well with public health concerns.
Yeah, and I think that, as you said, some other lectures might be able to answer it a little bit more, but absolutely, just to add on that, the government structures, but also, the kind of trust that we have in government and agencies, and kind of divides within the country of who trusts whom also, I think, matters. And certainly the cultural components of it, because if we're not speaking towards, as we're creating public health messages, we have to speak towards our targeted audience, and certainly that's going to be different. So some of our, the things that we might value culturally. And I think somebody else brought this up. So regarding things like our self-independence and our liberties, right? To not have to stay home. But then there's also the pieces of those who were saying, you know, who's carrying the burden of it? And that's a big piece when it comes to health communication of risk and outbreak, of who's kind of carrying that risk. And part of that can also be who is able to stay home. So that's also a question, right, of what countries might be making it easier for their citizens to follow those orders, and kind of who's benefiting and not benefiting from those orders.
Yeah, that makes a lot of sense. It's a really good point. Let's shift gears a little bit. And I'd like to talk a little bit about, or I'd like you to talk a little bit about social media. So I almost want to stop there and let you talk a little bit about social media, but let me go to some of the specific questions that were asked, because there have been a number about social media and how that's changed communication, especially around a crisis. Can you talk a little bit about how social media has affected communication, but in particular, do we know effective ways to combat dis and misinformation on social media?
You know, I'm teaching a course currently that I've been teaching for the last dozen years or so on social media, and we've had this discussion ongoing. This is another area for a completely different presentation. There's so much here to talk about. Let me just point to a couple of immediate thoughts regarding this. I mean, the first is, as Dr. Johnson was talking a bit about, one of the concerns about misinformation being spread is that when it comes from a friend, and think about social media, you see a friend post an article, you're thinking, well, that person's a pretty credible source. If they posted it, it's probably true. And that's a real hazard. That happens all the time. And I'm sure I've posted things that I didn't go back and verify, and we should get in the habit of doing that. I think it's important that we're looking for ways to verify that information. And I think Dr. Johnson might be able to speak to that a little bit more. The other aspect of this that I wanted to talk about is that this is obviously part of broader public argument regarding social media. There's been a battle most recently that has brought this to our attention, but that's been going on for quite a while. There's Section 230 of the Communications Decency Act, I believe, it was 1996, that governs how liable social media platforms or online platforms are for information that's shared. And the reason that's important, and it's centered on what this question is really about, if I post something that's incorrect, what's the responsibility for me or for the social media platform for verifying the data? And currently, it's set up in such a way that the platform is not held responsible for verifying that. Now, we've also recognized over the years that those social media platforms aren't what they were in 1996 when they wrote that law. It's a very different environment. And so there's a lot of discussion about reforming that and creating new guidelines. Some of the platforms have done a better job of developing policies and guidelines. And you've noticed that, you know, Twitter, for instance, has now started to attach statements to, and this is where there was a bit of a battle with the president when the president posted a tweet about mail-in ballots being fraudulent. Twitter said, actually, here's some information about mail-in ballots that we think is more credible. And that created quite a fight about, does that infringe upon his freedom of speech to be able to say, well, we don't think that's correct. So there are a lot of other difficulties that if the platforms get involved, what does that say if I post something and Facebook says, well, no, we don't think Anand's right about this. Here's a better source. Does that limit then my ability to express myself? So it really is a complicated issue. I think that the most important point that we've talked about in my class is the need for us individually to be able to verify a lot of the data before we post and before we read.
If I can follow up, it isn't also part of the issue that there's not agreement in what the reliable sources are, right?
Absolutely, yes. That's completely true. That's one of the reasons why I was so struck when I was looking at, and for my presentation, looking at commonalities in terms of what people across the political spectrum would view as credible, because we often don't find that kind of consensus. You'll find that people at different ends of the spectrum will find different sources credible. What Fox News might be credible to one is not as credible to others as they might find MSNBC. And so there are ideological reasons why you might view it as more credible or less credible. And so that really complicates this discussion.
Right. Okay. Let's move on. Do you think that people can eventually be overexposed to news about COVID-19? And do you think that the people will begin to ignore the advice of officials as events seem to improve? Dr. Johnson-Young?
Yeah, that's an excellent an excellent question. So I think I'm delayed a little bit, so I apologize if I'm interrupting anyone. But yeah, I absolutely think that's true. And we know that not just from the COVID-19 situation, but we can go back from decades of media effects research and show that that could certainly be the case, that if we're overexposed to anything, it could have repercussions. And some of those might be that we are oversaturated with information and we get overwhelmed. And then when we are overwhelmed, we shut down, right? So if we shut down that information, then we might be less likely to follow through. If we keep watching a news source over and over again and it's maybe sensationalizing the pandemic, right? Because our sources need to find a nice balance of not reassuring us too much, but also not over sensationalizing it. And if we continue to watch and we continue to get more concerned, we may be less likely to think that we can do something about it. So that also can shut down. And then, as you said, kind of on the opposite side of that, we also might just think, rather than shutting down, we might also say, hey, everything's kind of looking better. I've seen enough, and now I'll just go back my daily lives. So it really is an important balancing act that has to be found in order to keep people doing what they're supposed to be, or what we think they're supposed to be doing, to kind of continue to work towards a safe way to reopen and get back in the community.
Thanks for that. Some clarification about, I think, some of the language that we use in order for the spreading of false information to be disinformation. Does it have to be both deliberate spreading of false information and also have an agenda behind it? Or does it only have to include one of those two things?
That's a good question. I'll be honest, my primary concern with it is that regardless of intent and regardless of origin, information that is incorrect, that can lead to an undesirable result, is something that needs to be responded to. Now, I think the reason why you might be concerned about that classification has to do more with regulation and what do you do with an entity that maybe is starting to spread that. So does it have to have intent, and do you have to know where it's coming from necessarily? No, I think that many would say that you could still argue that it's disinformation if it's one, but not necessarily both, if I understand the question correctly. I think that the area where you would probably be concerned about that distinction would be in terms of regulation. But most of the time, I think whether it's intentional, not intentional, if you know the source, the key is about having the critical skills to look at it, to verify the source, to verify the data, and to be able to think about how does this really jive with what else I know about the situation. And so that's certainly, I think, the approach that we need to be taking. I think a decentralized understanding of how do we process this information is really important. The World Health Organization even coined a term for this spring. They called it an infodemic. And the concern is that we are so overwhelmed with information. We're living in an information age where, every kids in late grade school have phones that have access to more information than most of us ever had when we were kids. How do we parse through it is very difficult to do. And it's very difficult to ask a young person to do it when people our age aren't able to do it very effectively. That's tough. I mean, I think those are bigger discussions about all issues, not just public health.
Mm-hmm. To talk more about trusted sources, what does it take to become a trusted source, especially when some of them are attacked all the time?
That's excellent. Dr. Johnson, do you want to take this from a health perspective? Because I think certainly verified or peer review health sources might be a good way to start with this.
Yeah, sure. So in terms of finding trusted sources, absolutely something that's been peer reviewed, comes from data that some trusted organizations are finding, that you can kind of track back their data, and they're also sharing that data. So a source like Johns Hopkins has been really great about updating their site with massive amounts of information, but they're very open about where that data comes from and the process of getting the data, so that we know it's been gathered in reliable ways. So I think those are kind of good places to start. And then certainly our health organizations, I would argue, although I know that there's not necessarily consensus for that, but certainly something like World Health Organization and CDC, we should be able to find out how they're getting the data that they are for those.
But even, very verified sources, peer-reviewed journals make mistakes. And so I think part of it is also looking to see that you aren't going to find any source that always gets it 100% right. But looking at their review process, editorial processes, and also I think for me as a consumer of information, I want to be able to look at that source and see when they were wrong, how did they handle it? How do they retract that information? How do they let people know? Because there's some newspapers that are better than others about retracting stories. Sometimes they hide the retraction somewhere else. Sometimes they aren't as open about it. I think that speaks to me about their transparency and openness about when they're right and when they're wrong.
Right.
And with so much changing too, right? We have to, with an ongoing pandemic where we're constantly rolling out new information, I think that's a really important point too.
Right. In your presentation, you touched on communication at the presidential level a couple different times, and you shared some of the data on the response to that. Is it more dangerous though for a president to give a speech that falls short, or to just not give a speech at all? Which does more damage?
That's an excellent question. I think it depends on the situation. I think certainly if you look at the example of March 11th, the Oval Office address, the president needed to give a speech. The White House was right. They recognized there was a need for the president to speak. And as an Oval Office address was very different than a press conference. So I think that was important. We could probably play it out and say it didn't matter what the president was going to say. The markets were going to go down. People were going to be concerned. The developments over the course of the day, as I said, it was a very tall order to expect the president to do much more than just to try and calm the audience. So something falling short, would it have been worse if he just hadn't spoken at all? It probably would have been. And so maybe there's a case to be made that even when the president knows they're not going to be able to really win over the public, but the act of speaking shows that they're open to communicating, there's probably a good case to be made for that.
Let's turn to some more of the lingo that we've heard around COVID-19. In the last several months, we've heard our own governor here in Virginia use terms such as stay at home, shelter in place, quarantine. It seems to be feeding a variety of misinformation about what exactly is expected. How is something, is it supposed to be simple? Is it supposed to be a simple thing? And what are we doing that's going wrong here? Why is it being so badly communicated? Dr. Johnson-Young? Sure.
Yeah.
Okay, sure. I wasn't sure. I felt like you could also speak to that, but yeah, I think that those terms can definitely be misconstrued and misunderstood, and that's actually one of the things that I've been taking notes on to further try to research as we can is how are those terms being understood and very likely misunderstood. So what it means to shelter in place, stay home orders, you can tell that just from talking to people and seeing how people are reacting. They think they're following the right orders, but they might be doing something very different. And then we tend to use those terms interchangeably too. So all of that becomes pretty problematic. As to, I think part of the question was why we're getting those wrong. I'm not 100% sure why, other than maybe not using consistent language or defining it properly for the public, which is certainly a problem.
I hate to ask a question about politics to a bunch of communication experts, but do you feel that this has come up, and we could touch on this maybe on Wednesday when we have the politicians or the political science faculty with us, but do you believe that political leaders spread misinformation for political gain?
Yes. I mean, I think there's certainly examples of political leaders doing that for political gain. Hopefully we see fewer examples than we did in the past. It's a little more, you would expect it to be a little more difficult when we have access to so much information, when you hear a political leader make a claim that you can then verify is actually incorrect. But then there are a lot of questions about how the rapid news cycle has also made it more difficult to verify some of those claims. If you've moved on from the last incorrect claim to the next one, and people are still verifying the previous one, it really clouds public discourse and discussion. You can manipulate just the cycle, let alone just manipulate the data. So certainly there are examples of that, and that's a real concern. And that's part of, I think, individual consumption of knowledge, of information. How do we verify and how do we take it in? What do we do with it?
Right. Okay, well, I think we're going to wrap it up here, but there's one other question that got a lot of votes, and I wanted to address it briefly, and I think basically Dr. Rao and I can address it. The question is about social distancing in the fall when colleges are back in session. The question was, do you really think that social distancing is going to work once colleges are back in session? And it's a broad question about higher ed in general, I think. The answer is it can be personalized, of course, but I can tell you, I'll speak a little bit to what the University of Mary Washington is doing. And Dr. Rao, you've been involved in some of these discussions as well. And so I welcome you to jump in here, but it's a difficult problem. You know, if you're going to use what is considered a, sort of the national norm of the 6 feet and wearing a mask and those sorts of things, I think we'd all agree that that's just not enough in a college environment. When you have students living in residence halls, you have students packed into classrooms. There's a reason, I read very early on, there's a reason that higher ed was one of the first big major industries to shut down when the pandemic hit. And that was a response to the kind of environment that we live and we work in higher ed, especially in a residential campus like Mary Washington is. But for those same reasons, it's going to take longer for us to open back up as well, because of that environment. I can say that what we're doing here is we have an extensive planning group, a presidential task force that's looking at what additional measures have to be put into place to create a safe environment. Does, for example, does plexiglass need to be put up in certain places? Do we have to limit how many students can be in a classroom? Can we not really have them at capacity? Do we need residence halls to change the way students are in rooms? Does every room have to become a single? Right. All those things are being considered based on CDC and Virginia Department of Health guidelines. What do we need to do to make this a safe place? And it's going to be more restrictive than what the general public has to endure going, say, to the grocery store. It's not the same thing. It's a very different kind of environment. So that's the best answer I can give right now. But I know here at UMW, we have a task force working on it. We have a report expected to come out in the next week or two, which will address a lot of these big questions and how we're going to deal with them. But we are certainly making every effort to try to bring our students back in the fall. Anything to add, Dr. Rao?
Sure. Dr. Mellinger and I are both working on that task force, and there's certain elements of it that are just a matter of applying policy, but you're not going to be surprised to hear that somebody with a communication background is going to say a lot of this has to do with how well we communicate what we're doing and why. And I think about this even just going to stores. It went to one store that has made it very clear, even from early on, that the people would not be admitted unless they had masks and they followed 6 feet. And they communicated clearly with emails that were out, there's signs that are up, and when you go into that store, people are following it. And I went to another store recently that people had masks, but they were kind of hanging around their face, not really covering their nose and their mouth. And they were kind of following the mandates, but not really. I think so much of this is going to have to do with how well are we able to communicate why we're doing what we're doing. Because I think if we could communicate that, if we can motivate the people that are coming back to campus to really follow what needs to be done according to public health experts, then we're going to be able to come back and effectively have a good campus environment. But it's true as anywhere, and this is something that we're going to be facing as a society. How do we continue to raise that awareness without getting to COVID fatigue, where we're just discussing it all the time and people just kind of kind of lead off in terms of their interest. We have to be vigilant, and we have to make sure that we're finding new ways. And as for UMW students, if you have ideas about how we can do this, social norming campaigns, the memes page, anything that's going to be able to help get the message across, we need to be creative, and we need to make sure that everybody's buying in and understanding what we're doing and why.
Right. Well, on that note, thank you, Dr. Anand Rao, Dr. Elizabeth Johnson-Young. Thank you both for joining us. Wonderful, wonderful presentation and Q&A. Really appreciated it. And for all of our viewers out there, Wednesday is a big day for us. COVID and the 2020 U.S. presidential and congressional elections. We have Dr. Rosalind Cooperman and Dr. Steve Farnsworth joining us on Wednesday for that talk and Q&A. It's going to be a good one. You don't want to miss it. Thank you all very much. Students, we'll see you in the small group discussions in a few minutes. Everybody have a great week. Thanks and bye-bye.